It's Mickey the cat's turn to go undercover. He's also visiting 4 vets. We tell them he's off his food and all the vets charge about £40 for the consultation. Only one of them tells us, correctly, that Mickey doesn't need any treatment at all. 2 recommend minor injections. But one of the vets tells us that, in fact, Mickey has a bad back. He sells us a painkiller and warns that future treatment could run into the hundreds.
This is Mickey.
Hello, how you doing?
He's very feisty.
He doesn't look like he's got a bad back to me.
Whoa! Look at that! He's just drawn blood.
But I'm no expert, of course. I know a man who is, though.
So he's in pretty good nick. Obviously, he's got a bit of catitude, as they say. but he's in good nick. There's nothing really obviously wrong with him. He's got a normal temperature. His gums are pink. His teeth are in excellent condition. He's certainly fighting fit by the way he's acting. In terms of treatment, there's nothing I would prescribe for him at the moment.
Yeah. One of the vets kind of quite surprised us because he said that Mickey had a bad back. He prescribed us painkillers for a total of 54 quid, including consultation.
It could have been a twinge that happened on the day, but really, especially with cats, you wouldn't normally put them on an anti-inflammatory unless you'd done x-rays first.
And that's an anti-inflammatory, is it?
This is an anti-inflammatory. It's not my favourite anti-inflammatory. There are side effects. It can cause vomiting. It can cause diarrhoea. So really, you'd only give this if you really, really felt necessary.
Some vets have incentives, don't they, to sell products, which would come as a kind of surprise to a lot of pet owners.
You're absolutely right. Bonuses are awarded to some assistants, some partners who sell the most product. Okay, so if they sell more flea product, more worm product, do more operations, basically if they increase the bottom line, they get a percentage of that.
Big vet bills aren't usually a problem, of course, if you've got pet insurance, but less than a quarter of cat and dog owners are covered, which is why a record number of people are now abandoning their pets rather than pay those bills. This dog was dumped outside a vet's when she was pregnant with 4 pups. Now they're all looking for a new home and an owner that can afford them.
It's really sad, you know, how people can do this. You know, that they must have so many pressures to actually, you know, abandon a dog and her pups. These little ones are crossed with Staffordshire Bull Terriers and probably an American Bulldog, so they may look very small and cute and fluffy at the moment, but they're going to grow into a big dog that's going to take up a lot of someone's time, maybe a lot of someone's home, and also a lot of someone's money. It can all add up. It can be hundreds, maybe thousands of pounds. And that's why insurance plays a very important role.
The average claim for a dog has nearly doubled in the last 5 years, to more than £700. But some pet insurance companies say this is partly due to vets carrying out costly, non-essential procedures.
There'll be a lot of vets who are suffering because of the credit crunch, like every business, and an easy way to make money will be to milk the insurance companies. There's no doubt about it. It's pretty obvious. It's the first thing you do because the insurance companies will pay.
Vets sometimes go over the top in both diagnosing what's wrong with the animal and indeed the subsequent treatment of it. For example, a cat with lethargy being presented does not necessarily require a full spectrum blood analysis, nor indeed should it necessarily mean that the cat may have a tumour and therefore needs an MRI scan in order to diagnose that.
But if it's the insurance companies who end up footing the bill, why should we care?
The downside is the insurance companies will just end up questioning more claims, they'll put up their premiums, and they'll make insurance something that, you know, is out of pet owners' range now and out of their league.
It's Monty's turn to go undercover, visiting 8 vets with a made-up ailment.
Right, hang on there, Monty. Whoa, whoa, whoa. Hang on, come here. Look at me. Right, remember your story. You're supposed to be off your food, OK? It's a big day for both of us. All right, we ready? Come on then, let's go.
He's supposed to be feigning illness, but he doesn't seem to have got the message because one vet sees straight through him and tells us no treatment is required and no charge either. Most want £30 for a consultation and suggest changing his food. 2 vets, though, recommend injections to loosen his stomach and get things going. Monty's not very keen on that idea though, and makes a quick exit.
So if we brought him in like we did to you and said, we're worried about him, he's been off his food for a couple of days, would you just say, go home and...
I'd definitely quiz you about anything happening at home. Dogs, like any animal, like any human, are very sensitive to their surroundings.
Some of the vets did say that they wanted to give Monty an injection to get things going. Would you do that?
I think there are other things less invasive to try before we even get to that stage.
Like
because,
what?
you know, well, like changing the diet, first of all. Give him something that's more appealing than what he normally has.
Do you think vets are slightly too ready to recommend injections?
Well, Johnny, I really hope they're not. But my biggest fear with the profession at the moment is that, you know, it's easy money. And I hate to say it, but what we're experiencing, what I'm hearing, what I'm even reading about in the veterinary press, is that it's very easy to make money out of a situation that, in my view, and I'm sure in the majority of vets' views, doesn't actually need all this treatment.
We took a cat, a rabbit, and Monty to a variety of vets, and there was nothing wrong with them. We said that they were kind of slightly off their food and stuff, and we got a worryingly wide range of bills and diagnoses. Are you concerned by that?
I am concerned because I would hope that the sort of education that veterinary surgeons undergo and the continuing education and professional development that they undertake should not allow that situation to happen. On the other hand, there will always be two opinions on a case.
This is Lennox, the boxer. Lennox has taken a few knocks but keeps coming back for more. 5 years ago, as a puppy, he was hit by a car and taken to the Ancare vet surgery in Canterbury, where he saw the owner, Ranaz Sanyal.
He just took him off of us, said that he would do some x-rays, look at him, etc., and he would give us a call later on that day.
When he did call, it was bad news for Lennox, or so it seemed.
He said that Lennox had broke his pelvis in 3 different places and he had internal bleeding. I just wanted him to be okay for the children because they had such a bond with him. I just wanted him to be okay, that's all I cared about.
Lennox was apparently seriously injured and admitted for treatment. He was kept in for 4 days before Mr Sanyal finally decided he was well enough to go home. The final bill was £500.
I didn't resent the money because I would have paid whatever I had to make sure the dog was okay. I just wanted the dog to be okay.
3 months later, Lennox was in another scrape and he ended up seeing another vet at another practice. This vet gave Lennox a full examination and had some surprising news. There was no evidence of the pelvic fractures Lennox had apparently suffered just a few months earlier. It appeared those injuries had never existed.
I felt devastated, to be honest. Devastated that I trusted him. I trusted him to look after my animal and to do right by my dog. And it turns out that the only person he was thinking about was himself and trying to take what he could off other people.